Hi Abe. It's great to see you. I'm hoping we can spend a few minutes talking about healthcare communications. Healthcare has always been a hot issue for me. And now, with health reform and exploding healthcare expenses, finding ways to engage the consumer has become critical.
Great. This is a fascinating topic. While a lot of people think that health outcomes are genetic and take a fatalistic view, the reality is that our behaviors drive the majority of healthcare costs. So, figuring out how to engage consumers and encourage them to make smarter decisions makes a lot of sense.
Let's start with the basics. How do you define healthcare communications?
Healthcare communications come in lots of forms, from open enrollment materials to health fairs. They include new membership cards and explanations of benefits. Communications come from your insurance company, your providers, your pharmacy, and other health management companies. For people who are sick, this can be overwhelming. For people who are healthy, this can feel like all they hear is bad news, a bill or a denial of coverage. We don't always think about healthcare through the eyes of the consumer.
That sounds like a mess. Why isn't it better organized, and what can healthcare companies do to improve their communications? Or, to your point, how do they think from the outside in?
It is a mess, although companies are getting smarter. You are seeing people hiring chief experience officers and beginning to catalog and understand all the ways they interact with the consumer. In some cases, this might be 10,000 different communications. But healthcare has traditionally been a B2B business, so consumerism is a relatively new phenomena. That being said, healthcare companies can do several things. 1. Focus on the consumer and understanding their needs. 2. Using plain language and addressing health literacy. And 3. Coordinating their communications and messaging across channels and over time.
That sounds like a lot. Is it?
It can seem like a lot, but other companies have been doing this for years. Look at consumer products companies. They understand how to coordinate modes and present a single brand across channels, like web, direct mail, and call center. They've embraced new media like SMS and Twitter and integrated it into their marketing efforts. They've incorporated preference-based marketing, and they leverage longitudinal databases to understand customers' behavioral patterns for them. It's about the customer experience and building a relationship with them built on trust.
That's a great point. So we can build off what they've done and learn. And, to accomplish that, how important is data in healthcare communications?
Data is the foundation or the backbone. It helps you identify when to communicate, as in a gap in care. It tells you how the consumer has responded in the past. It tells you how to personalize the interaction. And it tells you how to craft the messaging to best get the consumer to listen and take action. This can be difficult. You have to start to understand the difference between groups and figure out how to best use data. In general, healthcare is different than other industries. You cannot simply throw a zip code-based model or a model based on credit score onto your data and implement it. You have to continuously test and learn to improve your results.
That makes sense. That approach has worked well in many industries. And the healthcare model is changing. It's a front-page issue these days. People want to know more, but it can be daunting.
You're right. But think about your healthcare for a second. Your impressions of a disease are based on what you know about it. They're based on who you know with that condition. It's very personal. And it varies over time. If you've been newly diagnosed with a chronic condition, you have one set of needs versus if you've had that condition for 10 years. Your relationship with your physician, your perception of your ability to influence your outcomes, and your plan design all play into what you need to learn and how you'll act. Of course, one of the best predictors of future behavior is the past behavior. That's true for adherence as well as engagement.
I hear a lot these days about behavioral economics. Things like loss aversion and hyperbolic discounting. I think these come from books like Nudge and Freakonomics. Are these important? How are you seeing companies use them?
Yes. The concept that consumers are not rational beings is important. We have to understand that framing information for people in ways that help them understand and create the best opportunity for them to take action is important. Words matter. And health literacy is a big issue. Patients don't get enough time with their physician. They don't understand their benefits. And they often have to balance conflicting information to try to make decisions.
Great points. Well, it's almost time to wrap up. Before we go, what about social media? Is that the next wave?
It could be. Certainly, it seems like everyone is using Facebook and other online tools these days. The idea of social interaction around certain diseases is important, and over time we will continue to see this peer-to-peer model evolve. Companies like Patients Like Me and other Health 2.0 companies are coming up with lots of innovative concepts. And figuring out how to create a virtual support network can be important and help influence people to make better decisions. But today, many of the chronically sick patients are older and not as likely to be using these tools. That stereotype is becoming less relevant, but one of the big challenges is engaging the unengaged. While there are more and more e-patients out there practicing do-it-yourself medicine, we still have a lot of work to do. Ultimately, the goal is to get the right message to the right consumer at the right time using the right medium.
Thanks for your time. It sounds like we may have to dig in on some more topics in the near future.